All right, everybody there? Well, happy Friday. Hey, that term gets old, but it's the weekend, so that's cool. So, want to take some time because there's nothing better to do on a Friday night this time of year if you sell health insurance than to talk about health insurance because that's basically what we do. Is we just work 24/7, but that's fine. We have a couple months to help you out. We love it. We send out our newsletter midnight on the first to all of our Pennie and Get Covered and a lot of our Healthcare.gov because we work in about 17 states or so. So everybody got our newsletter, and if you didn't and you want to be on our newsletter, you can see that on our website. So behind me is the backdrop for our new website. Once again, redesigned the website. This time went for a little bit different of a vibe, and we'll show that in a minute. But we have two different sites. We have doitformeinsurance.com. There's also doitforyouinsurance.com, which is just a marketing ploy and as a redirect takes you to doitformeinsurance.com. We also have the Medicare page on our doitformeinsurance.com/Medicare, but also has its own domain called doitformemedicare.com. So that's for our clients on Medicare who don't want to get lost in the flashiness of our main website. Goes right there, makes it nice and simple. Lots of cool features. So we're going to go through the website real quick, and then we're going to talk about some Pennie and Get Covered plans. And of course, we're here to help you. Have some best way to get a hold of us is email josephcovell@gmail.com or doitformeinsurance@gmail.com or also texting's good too. My number is 267-374-0975. All this is on the website, so you don't have to write that down or anything. So that's always a good way to get a hold of us, myself and Robin. And then also we have I got Calendly now too. So in the signature line of my email signature and also on the newsletter where I'll show you under our blog, there's a link that you can click to make a Calendly phone appointment with me. We can schedule a time so that we're on the same page and we know when to talk to each other. But it's not required. It's just a way to try to make sure we get to everybody we need to in the amount of time we have. Every year we pull it off, we get to everybody we have to. And if we don't, please leave us a message. It's a little hectic. We'll definitely get back to you. So we make it our job to get back to you within at least a couple of days at the very most during the craziest time. So, we're doing everything at once. We got under 65 health. We got Medicare options. We got small groups, mid-sized groups, larger groups. It all tends to just collide in this fourth quarter here. And of course, we're your one-stop shop for all your insurance needs, life insurance, fixed annuities, long-term care, home and auto, all forms of business, workman's comp. We do it all. So whatever we can do, check us out. So let's get right on into it. I'm going to share my screen. So I want to go right into our website. So we'll start with the Medicare site. This is doitforme.com/Medicare. So this is people over the age of 65 or on Medicare through disability. We have options, Medicare supplements, and we have options for Medicare Advantage plans. So this was something we took off of the parent company custom benefit plans that I work for too. This was something we had for custom benefit plans that was so good that we just kind of replicated it. So it kind of just explains how Medicare works, what Medicare and supplements are, nice lace and laid out what A, B, C, D mean, and how you can contact us. And then, it also redirects you right back to the main page. And these are also our subsidiaries. So different ways of marketing. We have pennybrokers.com, GetCoveredNjbrokers.com, Maryland HealthConnectionBrokers.com, and Healthcare.dot spelled out, Healthcare.gov brokers.com. So all these do is just take you to the page of here that is applicable to you. So if you go here under fee-free help, Pennie help, a cute way to get there is pennybrokers.com. Takes you right there. Same with GetCoveredNj. GetCoveredNj brokers.com takes you right there. Talks about our relationship with that and how you add us as your broker. does not charge you anything. And in fact, Jersey and Pennsylvania go out of their way when you call. It says, we do not give insurance advice. Please call a broker. And usually they'll give you 3 names or so. So they completely endorse us. In fact, I'll be working a Pennie event tomorrow from 10 o'clock to 1 p.m. That's in Hatfield at the Grace Lutheran Church. So I'll be there. You know, Pennie invited me to be there. I'm going to be there to help enroll people, answer questions. So, you know, they completely partner with us, especially us in-state brokers, you know, so they're, you know, so asking Pennie for assistance, they're going to give you somebody that's qualified and not some goofy call center in Florida or something that's just going to sell you nonsense without understanding what the network is. The value of working with somebody local, you don't have to see us face to face. You know, most of my clients, we just do things on the phone or via email. Yeah, but knowing someone who knows your market is huge. And, you know, in all the markets we sell, even if we're out of state, you know, we really go that extra distance and make sure we either have the local regional carriers or at least understand them. And if that's the right fit for you, that's the right fit for you. Such as Florida Blue Cross doesn't work with out-of-state brokers, and the brokers in state only work with Florida Blue. So obviously we don't sell Florida Blue, but you know, we have friends. I have a couple good friends of mine down there that we refer to. So we are fit for everybody. I work for an agency, Custom Benefit Plans, that has 100 to 200 brokers that specialize in this, that are the best in their game. And odds are I usually know where to go, no matter what state you're in, no matter which market it is. If I can't personally help you, I can find someone who is very qualified to help you, who is reputable. And it doesn't cost you a thing. That's why it's called fee-free help. There's no fee. There's no markups of any kind. The prices you see on Pennie, the prices you see with the carriers are the same prices that we give you. No fees, no markups whatsoever. And then lastly, Healthcare.gov. So this would be for Delaware, Florida. Most of the continental US still uses Healthcare.gov. So healthcare spelled out govbrokers.com takes you back to this site again. And then also, like I said, do it for you insurance. So if you type in doitforyouyinsurance.com, you know, you're going to get redirected back to the site. So I was just thinking with this, you know, we got the club and we got the guy in the thing, RC website group. Our buddy Rob, who has been doing our website for the last couple of years now, we decided that we want to kind of go in a different direction, and we wanted to really kind of attract the ones that are hard to get insurance for. So the ones that are really shopping online are the you know, the newly turned 26-year-olds and under, you know, maybe got booted off their parents' plan lately because of ACA laws. You know, you can only claim a dependent to 26 for health insurance. So, you know, that's confusing, and they don't know who to call. So we tried to make it, you know, attractive to everybody, but we really just kind of wanted to give a fresher vibe, just something that you don't see on your usual health insurance sites. So Rob did a great job. We have turning tiles here, little blurbs about everything. And then here, I think this is pretty good. So this isn't false advertisement. This is an $18,000 income. Plan costs with Independence Blue Cross in the Philadelphia 5-county regions, $321 for a 26-year-old. At that income, he would get $311 in subsidy, and his monthly price would be $15. And again, here's how you can message us. Here's our contact info. Everything you need is on our website. So we have all kinds of different pages, individual. If you're not looking, you know, if you're between jobs or you want an alternative, temporary insurance is here. United Healthcare is the only carrier in Pennsylvania doing that. Alternatives, it lists United Healthcare again, and alternatives being like a fixed indemnity type plan, like an Aflac style plan. You know, a lot of call centers out there will try to convince you that that's enough. It's not. It's really not. I mean, you know, something that just pays a fixed benefit in the event of a $400,000 hospital bill. I don't care what they tell you. It's kind of hard to rework that network pricing down to a point that you're not going to be walking out of there spending a lot of money. These are nice plans that work in conjunction. I have a Health Protector Guard. At my age, it costs me like $76 a month. I go get a physical, it gives me $200 back. I mean, you know, these plans are nice and they work, but they're not meant to be sole insurance. Also, your Medicare options. right? We got group and business insurance. So group is group health. This would be like workman's comp and liability, other forms of business insurance, dental options here. We have a quote tool. You can run quotes for your life insurance right there. Home and auto, you can run your own home and auto quotes. Also accident type plans. So if we go here, this tool, because we have Pennie and Get Covered Jersey, does not really work in a state exchange. So the options you see here are really not going to be the best for you. It all has to be done through Pennie, but we also have a relationship with Health Sherpa. We're going to have a link there to our actual Health Sherpa page so that you know you're talking to us. But it does kind of give you an idea if you put your information in here. I think it gives you a better idea of off exchange than anything, but so it works better in other states like Delaware, where you can actually see the products. So Independence, so Cigna's showing, that's a new company here in the Philly 5-county area, Oscar. It's not showing Ambetter, and it's not showing Independence Blue Cross, which is the majority of our clients have in this area, right? So it's not a perfect tool, but it gives you an idea. And then so that's kind of basically going over our blog. So like I said, if you want to join our newsletter, you can do so down here by putting your email, and you'll be subscribed to our newsletter. So, we try to update this fairly frequently. So here's our recent blog post, and it's just information we took from the email and put into the website. So it's not 100% perfect, but basically here's the link to book an appointment. Takes you to our Calendly, and you can schedule a meeting and see when I'm available. So it'll tell you the times I'm available, and you can just book your appointment. We'll talk. So a couple other things. Here's a new life insurance company we picked up called Bestow through North American. If you click here, you can run yourself some quotes. What's nice about this is there's no medical examinations. So you can literally quote and enroll yourself in under 10 minutes or so, and no medical, no nurses coming out to see you or anything. So is it the cheapest thing? No, but it's convenient, and it's not that much more expensive than others. But again, you can go under our life insurance tool, and you can quote yourself life insurance right here too, to see what we're talking about. All right, so let's get into the Pennie plans. So what I like, and then our Health Sherpa too. So here's our Health Sherpa. Health Sherpa, we'll have a link to it. It's also on this blog too. If you go on our blog and you go where it says, so you go to the first page here, read our blog. It's going to say get quotes now. It's going to take you right there. You see Robin and my pretty face there, right? Smiling from some time ago. So this doesn't let you enroll, but this lets you quote things. So if we just use this, Quakertown's bucks. I'd like to see if I qualify for a subsidy. 54 years old. I have a wife who's 47. And maybe I have a child who's 18, 13. I continue. What's your adjusted gross income? So your adjusted gross income is what they call your modified adjusted gross income. This is after your deductions, but pre-tax. So it used to be a line called adjusted gross income. They call it modified adjusted gross income. It used to be like on the old tax returns, line 22 or so, but it is a line on there. So that's what they're looking for. So let's just say that this family owns their own business, and maybe they have an income of $36,000. So they're eligible for $1,100, and the child's eligible for CHIP or Medicaid, depending on the income. So things are a little different here. this American Rescue Plan this year, really expanded a lot of help, and especially in PA, about June, just automatically applied. That's why everybody started getting a zero plan, and there was some panic there, thinking that their insurance got canceled. The assistance was great, and most people a lot of people had a zero premium plan. People with incomes that never qualified before got assistance too. For example, $100,000 income now gets a credit of $644 a month, whereas before the cutoff was around like 78,000 or so for a family of three. I mean, even at 150,000, you're seeing $290. So if we use 40,000, we're getting about $1,100, and then it applies to the plans. So Independence Blue Cross is still pretty much the go-to. I mean, in terms of network, there's nobody it doesn't have. All these companies are great. It's great to see competition. Cigna's brand new to the market. For here, I've never in my career, and I'm doing this about 10 years now, have seen Cigna ever offer an individual plan that's even pre-Obamacare, to my knowledge. So now it's cool that they're coming here to Pennsylvania. You just have to be cautious. Don't think that this is the Cigna that you get from your employer. This Cigna network is skinny network. It's Trinity, it's Holy Redeemer, it's Grandview, St. Mary's, and a couple others. That's it. There's no Abington, there's no Jefferson, there's no St. Luke's. So you really have to be careful here with this network. Don't just buy things because you think the name and everybody takes it. You have to check. I would say the one that has the closest network to Independence Blue Cross would be Ambetter. So Ambetter added a lot of great hospitals. They added Abington, Jefferson, and Aria to their network, which was the same Trinity, Doylestown, Grandview. Now they added Lehigh Valley because they're grown into the Lehigh Valley. So they added Lehigh Valley Health Network. Chester County Hospital, Penn was a part of it. So, and then Oscar's grown too. Oscar's grown to add Temple. So these options are growing. Your challenge still is with doctors, though. Like in Upper Bucks County there, Tri-Valley is a huge primary care facility. It has about 17 locations, is buying locations all the time. I think it just bought a couple down in Willow Grove. They don't take most of these plans. So just because Ambetter's accepted at the hospital or Oscar's accepted at the hospital doesn't mean that your primary care doctor accepts it. So but I tell you what, we have great relationships with all of these companies because of the business we do with them. So, let us work with you. If we find a doctor that's not in network, we will work with these companies. We'll try to get them, if the provider's willing, we'll try to get them in the network. We did that with Ambetter and Cigna this year. We did it for a lot of the Asian and Russian doctors that are brokers. Clients, because we have a lot of Asian and Russian clients through our Russian and Asian brokers. They got us a list of doctors, and we're really able to work our tail feathers off here to try to get them in the network. So if we're here to work with you in any way we can. We want to see these companies succeed. We want to have options in the marketplace. So obviously, Silver's still kind of the place to go for the most, but I want to make this really simple. So I want to make just a single person, and I want to use an income of $18,000, which is the minimum income that you can qualify for the Affordable Care Act or Obamacare, individual health insurance, Pennie, whatever you want to call it, right? So here, most likely you're going to see some sticker shock. From 2021, I'm going to bet that a majority of you were in the Keystone Proactive Light. And I bet it was, for most of you, even before the assistance, this was a zero or very well close to it. Now you're going from $0 to $127. So, there's some shock there. The newest plan, and I don't understand all the mechanisms of why they do this, but basically they want to have the lowest silver that they possibly can. They want to do what they can to keep people happy. So in normal years, you would have gotten, in other years past, you might have gotten mapped into a plan. That's not the case here. You wouldn't have gotten mapped. So for a lot of people, you're going to probably want to switch to this basic plan. And if you look at the difference in the plans, right? These are the exact same plan. I mean, it's $5, 15, 4, 50. I mean, don't hold me to saying exact, but they're pretty close, the out of pockets. So, and again, this is at that income. These things vary. So if I put a $50,000 income in there, um, these benefits vary. It's still not much of a difference. The only difference between these two plans is $500 more for the hospital in and outpatient, right? That's it, $500 more. So even at that plan, it's still, if you did this for most of my clients, if you do this calculation, I don't know if this offhand, most of the time the savings per month is adding up to be more than the $500 deductible increase. So it's definitely worth considering. Of course, we're there to help you. But what's nice about Pennie and Get Covered is if everything is the same in your account, and I can't really show you an account because I don't have a test account and I can't show you client data, but you can really just go into the account itself and you can just change the plan if nothing's changed. If your family makeup hasn't changed and your address and your income hasn't changed, all you really got to do is change the plan. So that's what I've been doing for a large portion of my clients, is simply taking them from this plan to this plan. So that would be the one to do. And of course, we're there to help you. If you're confused, shoot us a text, give us a call. No big deal. Also to think about is Ambetter. So I said Ambetter, had a lot of network improvements. So let's go back to the full cost sharing. So 18,000, this Care 30 is really interesting, and I'll show you why. Ambetter really pays attention to the markets. They do. So with Ambetter here, and this is the #1 Affordable Care Act company in the whole country. They're in just about every state, and they're good in every state. It's also a national network. So anybody that takes the EPO, you can go to Jersey, you can go to Delaware, as long as the doctor accepts the Ambetter EPO, you can go there. In most cases, again, I don't like to speak in absolutes, right? Like Yoda, I want to speak in absolutes. So what's interesting about this, right? Everything's no charge after deductible. There's no deductible. I'm sorry, the deductible is $625. So the deductible is $625. After you pay that, that's the most you pay for the year. So your max out of spending here is $2,150. Hold on a second. This isn't ending up here. I question that. Let's go to Pennie. So we're going to go to I just saw something different on Pennie. And Health Sherpa again doesn't let you apply. So they're only really showing you this because if you were to go start the application, it just tells you to call me. Like they can't facilitate it because it's all Pennie. So I just want to double check something. So if you go to enroll.pennie.com, you don't need this other stuff. Enroll.pennie.com. This will take you to the page where you can quote yourself without having to log in to your account. So I recommend you do this before you log into your account, start playing with your application. This is easier just to get an idea. So don't start playing with your application until you know what you really want to do and confuse it, right? So see if you qualify. Okay, sorry, I picked the wrong age. See if you qualify. You qualify for $700 a month. Skip the plans. This doctor and prescription finder, I don't recommend. You want to look up a doctor, go to the company's websites. There's links in a lot of this. Health Sherpa has a link. Just Google, Independence Blue Cross. Well, that's IBX.com. And then there's Find a Doctor, right? IBX.com/ and then Find a Doctor. Use this to search doctors. Don't use the Pennie tool. Same with Ambetter Health. Find a doctor. Use the tool, right? Lansdale, Abington, Good Shepherd, Doylestown, Suburban, Abington Memorial, so Norristown, Eagleville. So there's lots of different options here. Roxborough. So it's really grown. It's grown nicely. St. Mary's, Thomas Jefferson, from where it started a couple years ago. Will's Eye, Lower Bucks. So lots of different options for you. Doylestown, I did say Doylestown. I just said Grandview's there too, I think, right? Yep, Grandview Hospital. There you go. Okay. So lots of options there, but you just have to, you have to check your primary cares. So that's a bit of a challenge. So, it's growing. Every year it gets better and better. Oscar Health, hioscar.com. Member resources, find a doctor. They have Grandview, they have St. Luke's. So they have St. Luke's. So Lehigh Valley is Oscar, St. Luke's, and then Ambetter being Lehigh. Capital Blue Cross PPO, no problem. Everybody takes that. Capital Advantage EPO is a St. Luke's play. The Highmark options, the My Valley Direct, they've always been Lehigh play. Geisinger takes the best of both. UPMC usually takes a good bit, but they've kind of gotten expensive. So we'll go through that a bit. But I just wanted to again go to the silver plans with this. Take a look at this plan. Okay, it does have a $600 deductible. All right, that's my mistake. So, it's nice in the fact that it's zero. So for zero, you only spend $600 and then you're done. So unfortunately here, you don't really get any copay. So you spend $600. But if you anticipate high costs, that may be a play for you. The Silver Proactive Basic here is $24 for this demographic. So this is still probably going to be the plan most people go with and stick, because even though it's $2,100 is the most you could spend, everything has a copay. There's no deductible to be met. So it's going to be very hard for you to get to $2,100. So in most cases, 99% of the time, this is still really going to be the plan for most people in this area. But that's the 5 counties of Philadelphia. Let's look at Allentown. So this is a bit of a change. Majority of people this year were that I worked with were in the PPO or the EPO for Capital Blue. That was very competitive. Now, Ambetter's come looking real aggressive. So Silver, Balanced Care 30. There's some better plans. The 32. I usually like the Balanced Care 11. Where's that one at? That's the one I've sold throughout the years. This one's a little more expensive at $82. But where's Cap? We're on the first page. We haven't even gotten to a Capital Silver plan. So here's our cheapest Capital Silver plan, $167. So, we just saw a whole slew of Oscar. So Oscar and Capital take the same network. They take that St. Luke's. And then you got Highmark in there too. So the first 2 pages are dominated by Oscar and Ambetter. So they're getting a lot of attention. But you got to check your doctors. Again, you can't just buy something and not check your doctors. So my pick's always been this 11, and you could get it with dental and vision if you like. So it's $82. I tend to like this plan because no deductible, out of pocket's $1,000, most you can spend. No charge for your primary, $5 for your specialist. And then your more extensive stuff, you're going to 25 co-insurance after your deductible. So you're going to beat your well, you don't have a deductible, so you're going to pay 25% up to that max. Which sounds scary, and it does sometimes. And then your prescription cards, generics are no charge, $25 brand. It's a very nice plan. I like this plan a lot. The dental one with the adult dental and vision I kind of stray away from that because as hard as the doctor networks have been, the dental network, I mean, that's the thing with that, right? I think you can still find plans here. So everybody asks me about dental. What do I recommend? This is always the same conversation I have when it comes to dental, right? A good dental plan will cost you $30 to $50 a month. You will have a 12-month wait after the, with exception for Cigna and Humana, who will waive the waiting period if you have prior coverage. So if you have prior coverage, Cigna and Humana dental networks are the ones to go with because they waive the waiting period. Other than that, you have a 12-month wait for major services. You'll get your cleanings covered, but a 12-month wait for major services. After that 12-month wait, they're going to cover about 50% up to the plan's max of around 1,000 to 1,500 to 2,000, whatever it might be. And then that's it for the year. So you're going to end up paying more in premium most times than you're going to get out of the plan. So what I recommend often is you go with one of these inexpensive dental plans. So you have an option here between this network, Delta Care USA, and the PPO. I tend to go with the PPO because then you have more options. You can go in and out of network. Not all dentists take insurance. In fact, you could have 9 dentists in the same building. They could all charge a different price for the same service. So it's always good to shop around. If the dentist says we don't take it, but we process it, that just means they're going to fax it into the insurance company for you. So that means they don't take it. So, and a lot of times the way these works, if you're out of network. So if you're out of network, the percentage paid is based on the usury and customary charge. So say you live in Lansdale and a root canal has a going rate of $300. If the dentist doesn't take your insurance and charges $500, the insurance company is going to pay whatever the benefit structure is up to the UCR, usually customary rate, which is going to be the 300, and then you're going to get balance billed for the remainder from the dentist. So that's the thing to keep. You really want to try to go to someone that takes your dental insurance because they agree to the terms of the network. So for the $13 plan, you go to someone that takes this network, they agree to the terms. In most cases, I mean, I've checked this with Delta, but we can go through it again. In most cases, if they accept the Delta network, you should get the Delta pricing. So that if a service is $500, but they take Delta and Delta's price is $300, you should be paying the $300. Now, again, I don't like to talk in absolutes, right? But that's how this should work. So why do I like these inexpensive plans? They'll cover a couple cleanings or so, and they'll hopefully give you that network discount rate, so that you get, it's basically like you buying a discount plan. You could buy a Carrington discount plan for $5 or $10. We actually sell one here. Where is it at? Sorry, I'm just kind of still learning the website. Discount dental and vision, not working anymore. Sorry, I'm going to have to update that. But it was an express product that we had that worked there. So I'm going to have to get that again. So that's my spiel on dental. So I think that's good for PA. I think we kind of covered that. I don't know if there's any questions or not. Let's see. I don't know. All right. So for the same income, let's look at a couple of different options. Is there a deductible here? There's no deductible there. What would I like for Oscar? It's an interesting plan with $100 deductible. So actually their gold plans are more affordable, but when you have a lower income, you get help with the CSR, the cost sharing reduction. So they bring those benefits down. So if you're not familiar with that, I will illustrate that for you real quick. So if I look at, let's just take this out, right? If I look at this at an $18,000 income, Look at my out-of-pocket, look at my deductible. So here I lost my tax credit a bit. But see, my deductible and my out-of-pocket and my copays all just jumped, right? That's called cost sharing reduction. What that means, if you fall within an income bracket, a certain income bracket or percentage of the poverty line, they call it, there's a chart. So if it's usually between 130% of the poverty line to 250 or so, you get cost sharing reductions where they make the benefits get better based on the income. That's only applied to silver plans. So why in certain markets are gold plans better than silver plans? Because during the Trump administration, he decided that the cost sharing reductions were not going to be paid by the government anymore, and the insurance companies were going to have to pay because it was in the law. So a lot of insurance companies, most of the country, make the gold plans more affordable than the silver plans, but knowing that they have to pay that. That's not the case for Independence Blue Cross because they've always had a zero deductible in tier 1 of the silver proactive plan. So because of that, it didn't affect the 5 counties so much, whereas it did for other carriers. So that's why you see gold plans are more affordable than silver plans often for places like Lehigh Valley. But so that's the cost sharing reduction with that explained, right? So it's based on income, can vary your benefits. So here, we're looking at a gold plan here. So it's very hard to compare that when we have an $18,000 income. And we just have to get to silver. All right, it's just all over the place. Yeah, so here's the plan I've been selling a lot of people. So, it's jumped from $0 to $254. You don't have network problems with this. I'll tell you that. I mean, this is anywhere that takes anywhere that takes Blue Cross PPO, you're going to be in network pretty much in the entire country. But, you're paying for that freedom now. So, you really have to pay attention to what you buy, guys. And I tell you right now, like, with Ambetter being a national company, there's call centers that are targeting you. So if you're filling crap out online, you're going to be getting phone calls from all kinds, like Timbuktu, and they're going to be trying to sell you Ambetter, not telling your doctors in the network because they just don't care. All right. It's not like Medicare. Medicare is very regulated by things. The Affordable Care Act's not as regulated. So it's easy to be taken advantage of here. Don't answer that phone. We're here to help you. Call, email, text. We're here to help you. We have till January 15th, till the open enrollment's over. We will get to everybody. Don't buy crap on the telephone. Unless it's us calling you. We'll do. But other than that, make sure they represent the companies in your area, or at least like give you an objective opinion of the companies in your area and tell you when it's not a good idea for you to change. That's with any product, by the way, So here's our comparison. So benefit wise, I mean, this looks really solid. 0 versus 425. Everything's showing up better here. Very, very comparable. I mean, Amber looks really good up there. Oscar don't look half bad either. So that covers PA for the most part. I don't know if you're in Western PA. Obviously, it's really just a 2-carrier town still. So you got I don't know what it is. 15. Well, it's guess Geisinger made their way out there. That's news to me, not sure, but not the most up on Geisinger, but it's just pretty much UPMC, Highmark, and then I guess Geisinger did some expanding. Interesting. Okay. I don't know everything. Not going to pretend to. Pretty close. All right, so let's go over to Jersey for a bit. Oh, and by the way, I have Pennie walkthrough. I made this video. Right. Well, not that video, but Pennie and broker account setup in ACA and broker selection. So I go through here and show you how to find us and add us, set up your account, select us as a broker. So that's there too, as well as, like I said, the walkthroughs on our website here, how to add us, Pennie.com, step by step, how to add us. So you can find all that there. So I don't want to waste your time with that. So let's go over Jersey a bit. Enroll.GetCoveredNj. Same exact vendor. So let's just put Camden in. And 1975, and he makes $18,000. That's their sweet spot, right? So I guess $500 a month. Guess who's over in Jersey? Would be Ambetter through WellCare. WellCare has offered senior products, Medicare Part D and Advantage plans for a few years now. Now they got Ambetter. And here is the kicker when it comes to Jersey. Jersey has a network problem. All of the Jersey plans is one plan in New Jersey, and that's the Omnia Gold. That is the only plan that lets you leave the state of New Jersey for non-emergencies. Look at the cost of that. The Ambetter plans let you go into PA and other states that take Ambetter. So it's a national footprint. Not that it's always going to be the greatest, but at least it gives you the option. Whereas typically you'd have to go with the regional preferred to be able just to go across the bridge into PA, or to have true freedom to go to any blue doctor. You'd have to have the Omnia Gold specifically. So that's a huge thing for New Jersey, that we now have a carrier that lets you leave Jersey again if you wish to. So if we compare silver plans, we got our friends at AmeriHealth, which is same company as Independence Blue Cross, their sister company, owned by the same parent company. And then we got a little bit of a deductible on that. Or let's pay $6 and get a $50 deductible. No, mathematically, this would probably be better. So we'll do that, and then we'll do the Omnia value. Do a comparison. Again, I wouldn't go into our account and mess with this, right? Use the tool that's on the page. It doesn't make you sign in. And then, by the way, go to help and support, right? Find local assistance, find a certified broker. Type in this clown's name here. And there we are. There's my smiling face. You just add me as your broker when you're in your account. And then I get an approval, and then you find I'm not doing my job, you take me out as easy as you put me in. So again, look at that. Check your doctor. I think I still go to the website, right? So who does Ambetter have in Jersey? We got Penn. Remember, you can go there. Our Lady, Virtua, Inspira, Methodist, Will's Eye. So definitely some options. Yep, look at that. You go right across the bridge. Don't need to be an emergency. So I think that's what I would do. Ambetter is in a good bit of the state, more than Oscar. Oscar is only to the north and Ocean County. Oscar's good in Jersey. If you ask me, I think Oscar's best network, period, is in New Jersey, simply because it's the only place they don't try to build their own network. They actually rent the network. I believe it's the QualCare network is what they rent. So you have access to a much, probably one of their better networks. So again, they're just pocketed, and that's been one of their longest states they've ever had. But Ambetter as well care here, fantastic option. And then to end things a little, let's just do a brief on Medicare. So if you go on our site, right, Medicare, do it for me, Medicare, and you go to supplements, you go to our quote tool, you can quote yourself a supplement, you go to Part D, takes you to our Medicareful page, which is to our one vendor. This doesn't have all of our options here, though, just to forewarn you. This only has the options we have with this vendor. And there's a little kicker here. It tells you right here, not a full list. Please call me for a full list. I have every plan in the state of Pennsylvania except for Gateway and Vibra or something like that. Other than that, I have just all of these carriers and more. You're not seeing ARP. You're not seeing Cigna here. I have those two. I will give you fully detailed reports in my new system where I can do all kinds of different quotes for you. I can run your drugs. But this is a tool where you can simply quote and enroll yourself should you like something. But I'll do a separate video for that, to go through Medicare options. Well, you know what? We'll just talk about it now. So PPO options, this is Lehigh Valley. My picks, and again, it's based on your drugs, right? We run your drugs. This is a consumer-facing site. I mean, this is a broker-facing site. There's not a consumer. Hopefully for next year it comes. So I could see every plan here. I can run your drugs. This is technology I have. Just so you know, this tool built the original Medicare.gov Find a Plan. And then they got rid of them, and they've had disaster ever since they did it themselves. So I actually kind of trust these guys since they used to have the working tool. But, Medicare.gov/Find a Plan is still there. I use it all the time, right? Medicare.gov Find a Plan. So be able to save prescriptions year over year, because this time of year, my senior clients, my Medicare clients are wanting me to check their drug plan. So oh, by the way, if you're an agent liking this and you want access to this, if you do business with us, we give this to you for free. I don't know why we're having some problems here. So I could pick your dosage, add that to your cart. How many times you take it twice per day, right? Here's your pharmacy. Go to Rite Aid, whatever, pick 2. Go to plans. So what I'm getting at is I can do this for you and give it to you for free. Give you a free report. I can email it to you. I can send it to your phone via text. So if I have a prescription plan, if you have a Medicare supplement, you need a prescription plan, this is the score. We do total costs in. Those are very inexpensive drugs. I don't know why it's doing that. But so same with Medicare Advantage plans. So that's a tool I have. But going back to here on the page that you can see, because you can't see that, I have to do that and send it to you. But basically I would put, well, here, I'll just show you again. So I did PPO options. So this Valley plan, we've never, in my time, we've never had a 5-star plan in Pennsylvania. Now we have 4. We have Independence Blue Cross, their HMO plans. We have a couple Aetna plans. Highmark has a 5-star plan, and UPMC out west. What does a 5-star plan mean? If a company achieves 5-star status, it means it can take an enrollment year round. So someone who lives in a 5-star area means they can buy that plan regardless of their situation. If they had original Medicare and a supplement, had another plan, whatever it might be, any time of year, they can do that once per year. So this means year round, you could be buying anything that's a 5-star. So like this plan, 5-star, you can buy it. So this has been my go-to here. And I don't know, let's write it in there. So here's my options here. And this shows me every company. There is a toggle switch to see all plans. So I will give you an unbiased opinion. And I could simply send you the quote to your email or to your text. So that's the software we have this year. But let's just look at some of the, what you can see, just to show you I have everything. So same thing, there's my plan options. In the Philadelphia area, this is a new plan. So the Joe Namath ads teach us that he can help us pay for our Part B. What he doesn't tell you is it's based on where you live and if a plan's available. And what they're trying to do is try to get you to call, because what they're going to tell you is they're going to see if you apply, if you qualify for any Medicaid or state programs, which can help you pay for your Part B. The only things that help pay for your Part B, this plan helps you pay for your Part B. It gives you $50 a check in your Social Security check, but where it gives, it taketh. So here, for outpatient surgery, you have to pay 20% of the bill. So versus you just paying, say, on this plan, a $300 copay. So independence right now is just very hard to beat. I mean, depends again on your prescriptions and your doctors, but you usually don't have network problems with this. So here, kind of proud of myself. I feel like I kind of helped them build this. I helped the product team work with, I sent them some things on Capital and Highmark for the per stay benefit, which is what was nice about Highmark. So most of these plans I've always had a per day. You pay $200 per day in the hospital for the first 5 to 7 days, whatever it might be. Highmark was unique that it came out. Well, Aetna had a per stay for a few years now, but had a premium to it. You paid $100 and some odd a month. Most people want to have a zero plan when it comes to Advantage. Otherwise, they maybe pay for a supplement, something of that nature. And I get the question, like, why is it free? The difference is when you have original Medicare and a supplement, you can go to anybody, anywhere in the country that takes Medicare, and they'll take your supplement. Doesn't matter what your supplement is in most cases. With an Advantage plan, it's basically the government saying, I don't do such a good job of administering care to Johnny G. Here is $1,500 a month. They do everything for you. So that being said, that takes over Medicare for you. You, in essence, surrender your Medicare to the government, who then pays a private insurance company, but you still have to pay your Part B premium, your Part B $148 premium. So this plan and a couple others give you $50 towards it, but then they take away from you in other aspects. I like this plan because it has a per stay. So someone coming from a supplement or original Medicare or whatever it might be doesn't love the idea of having to maybe shell out $1,800 for a week in a hospital. This is kind of like a middle ground to consider. And then obviously here, so we do this here. So you can compare these plans here on your own on our website that I'm showing you, right? Compare 3 plans. to show that I'm telling you here what I'm telling you. In network 20% cost share. So that means you'd pay 20% up to the plan's max of $8,000, 7,000, yeah, 7,500. Here, whether you're in the hospital for a day or for a week, you're going to pay the same $525 per stay. So if you're in there for a day, you lose out. If you're in there for 2 or more, you make out. So it's how you look at it. So this is a very good plan in that sense. And like I said, I feel like I helped them build that. So that's, because we do a lot of business with them, and they value our input. So in a nutshell, I think that's about it. If you're watching me from another state and you want me to, you get our newsletter. We have links to our quote tool. Like specific bit of exciting news is in a lot of the country, we have United Healthcare returning to the individual market where they haven't been since 2016, although they were in a couple states last year, and it is Aetna CVS's last time. So they have not been here since 2016. So these two companies are back. Got to watch the networks too, but they're looking pretty nice. It's nice to see the big companies coming back, guys. This is good. This is what we want. We want a world where the top 5 insurance companies are offering products to the individual market. It wasn't good when they didn't look good that they weren't doing that, right? That doesn't give confidence in the system when the top 5 insurance companies, 2 or 3 of them are the only ones participating, right? You got Humana, Aetna, CVS now. CVS owns Aetna, right? Anthem Blue, Cigna, Anthem, Aetna, Humana. Sorry, having a Friday brain, AEP brain, we call it. United Healthcare, right? So having them not in there, or United Healthcare going out of their way to tell everybody to buy short-term medical plans instead of Obamacare, ACA, wasn't a really good look for the system. So it's great to see them coming back. So they have some options. We deal with in Florida. We deal with all of these companies except for the Florida Blue, but you can still enroll and shop, and you can enroll through our link here. We don't prevent you from doing any of that. So that's basically it. Thanks for hanging in there with us, and enjoy your Friday night, weekend. I'm here to help you. Again, doitformeinsurance.com for all your insurance needs. Take care. Have a good time. Have a good weekend.